The podcast bros, they're not covering this. They're not going over what we're going to talk about today. And that is the skin warning signs that your estrogen is too high. What your skin is trying to tell you about your hormones being out of whack, as they like to say. Estrogens are typically considered the female sex hormone, but both men and women have estrogens, and they actually play an important role in both of our baseline healthy physiology, so they are something normal and good. However, there are a variety of scenarios where estrogen can get too high, and like always, your skin, it'll give you many clues. There are three main categories of estrogens. There's estradiol, which is the most potent estrogen. It's produced by the ovary. There is estriol, which is produced by the placenta during pregnancy. And then there's estrone, which is produced in our peripheral tissues. Like I said, both men and women make estrogens. Men can make estrogens in their testes as well as peripherally. Your estrogen can be too high as a normal healthy thing, such as, well, during pregnancy. Perfectly normal to have increases in estrogen. It's to be expected. It would actually be harmful if it was not the case. But then there are a variety of disease states and exogenous reasons to have high estrogen, such as taking oral contraceptive pills or hormone replacement therapy, as is given to women in perimenopause and menopause, women who have to take exogenous hormones in order to control dysfunctional uterine bleeding. Also, men who take testosterone replacement therapy, it's possible to have an increase in estrogen due to peripheral conversion of the exogenous testosterone to estrogens. Then, of course, you can have tumors that produce too much estrogens. These include tumors of the ovary, the testes, the adrenal glands, and the hypothalamus, which is in your brain. Certain recreational substances also can cause elevations in estrogens, namely alcoholic beverage consumption as well as marijuana. A scenario where you get an elevation in estrogen hormones is actually end-stage liver disease, because the liver's processing of hormones becomes impaired. And typically we think of end-stage liver disease, cirrhosis, as something that alcoholics eventually go on to develop, which is absolutely true because alcohol poisons the liver. But there are a variety of other underlying medical conditions that can lead to end-stage liver disease as well, and elevation in estrogen is characteristic of all of these. Then one reason for elevation in estrogen that almost no one talks about, which surprises me because it has become an increasingly common reason for estrogen to be high, is actually obesity. Central adiposity, that is. Excess fat centrally distributed around your waist. That is a danger zone, actually, to accumulate excess adipose tissue. It acts as almost its own organ at that point, releasing and secreting various inflammatory mediators as well as hormones, including estrogens. A characteristic skin finding seen in a variety of scenarios with elevated estrogen is going to be pigmentation, increase in skin pigment. This is very typical during pregnancy. About 90% of women who are pregnant will develop either localized or generalized hyperpigmentation. This often includes darkening of the nipples, darkening of the genitalia. One might also develop what's called the linea nigra, a dark line up the abdomen. Also, your moles might begin to darken, and you may even develop new moles, which, as a side note, any new or changing mole should always be shown to your healthcare provider. Hyperpigmentation can also be seen in end-stage liver disease. As a side note, check out my video on signs of liver disease, because I do a deep dive on various skin conditions that you also will see along with liver disease, above and beyond what is related to the increase in estrogen. You also can develop melasma during pregnancy or other situations where the estrogen is high. Melasma is a hyperpigmentation condition where you get these patches of irregular discoloration that has angulated borders, often on the cheek, the forehead, the upper lip, also can be on the neck, and sometimes the upper chest as well. Rare to see this in men, but in these pathologic conditions, these disease states, it has been known to appear. Many of these skin warning signs of elevated estrogens are going to be related to the development of vascular issues, because estrogen actually increases blood flow and leads to the development of little blood vessels. One characteristic finding that is seen oftentimes in pregnancy, but also can be seen with taking in estrogen exogenously or with end-stage liver disease, or in any really of these underlying conditions, men and women, and that is a reddening of the palms, palmar erythema, especially these areas of the palm known as the thenar and the hypothenar eminences. Now, I have a whole video on why your palms are red, okay? okay? There are a lot of potential reasons. So before you freak out and think, oh my gosh, my estrogen is too high because my palms are red, calm down. There are other possible reasons, so check that video out. In addition to palmar erythema though, these little blood vessels might sprout up on your skin. One such finding that is often seen sometimes during pregnancy, but also in end-stage liver disease or with taking even exogenous estrogen, something called a spider angioma. It's called a spider angioma because it's this little red bump that looks like the body of a spider, and coming out from it are these red lines. The red spot in the center is typically raised up, so it really looks like a red spider. Now, these can regress, say after you deliver, in the case of them coming out during pregnancy. Sometimes they will persist, especially if you are taking in some sort of hormone exogenously, whether it be testosterone that's getting converted or hormone replacement therapy or oral contraceptive pills, or they definitely can be seen in end-stage liver disease, as well as with excessive consumption of alcohol and possibly even marijuana as well. And they may crop up with obesity. They may go away, but sometimes they persist. There are treatments that can tackle them to get rid of them, such as intense pulse light and various vascular lasers that target the blood vessels. Speaking of blood vessels, you also can develop what a lot of people refer to as broken capillaries. The medical term for that is telangiectasias. Often can happen on the cheeks, around the nose. We see these a lot actually in patients who do have end-stage liver disease as a result of the elevation in estrogen. There's a vascular phenomenon in the hands known as Raynaud's phenomenon that is seen oftentimes in association with elevated estrogen levels. Raynaud's phenomenon involves these episodes, often triggered by cold exposure, where the fingers turn white because the blood vessels are clamping down. They go from white to blue, and then as the blood flow releases back into the fingers, they turn red. That's known as Raynaud's phenomenon. And there are many underlying conditions associated with that, but elevation in estrogen is one. Let's talk about your hair, because as a reminder, dermatologists, we don't just focus on skin, we focus on hair, which is an extension of your skin. Estrogen prolongs the growing phase of the hair cycle. That growing phase is known as anagen. Pregnant women will relish in this during pregnancy because their hair on their scalp is fuller, thicker, growing longer, feels really lush. However, as soon as you're no longer pregnant and the estrogen levels decline, the hair cycle will shift around to the resting phase and the shedding phase, and then, you'll get a massive hair shedding. But it definitely can prolong the growing phase. Also, you may experience an increase in hair on the body. This is for women. Facial hair, body hair, maybe your leg hair is growing quite a bit. That's something that a lot of women in pregnancy will observe as it relates to the increase in estrogen. You might even notice this also with taking in hormone replacement therapy, oral contraceptive pills. Is that why you take these medications? They make your hair grow like wildfire. Men, not so much. All right, men, they tend to, in scenarios where their estrogen is too high, they tend to actually have sparser body hair. They might lose their underarm hair, the hair on their arms. Their pubic hair may go down quite a bit, and also may lose quite a bit of their facial hair as a result of the increase in estrogen. Now, the other thing that having too much estrogen might definitely play a key role in influencing the development of is actually stretch marks. Now, if you've watched any of my videos on stretch marks, the medical term for which is stria, I always tell you guys that some people make them, other people don't, and those who make them will make them, and those who don't won't. And it's very difficult to predict if a woman during pregnancy will or will not develop stretch marks. Stretch marks happen when you have a rapid expansion of the skin surface area. It stretches rapidly and the skin kind of can't really catch up, and you get these stretch marks. They usually appear reddish purple in the early stages. That's known as stria rubra, and then they turn white. If they are treated in the early stages when they are reddish purple, a lot easier to tackle, as opposed to once they turn white, then they are very, very stubborn to improve. But there is likely an influence of estrogen in whether or not someone develops them. They also may develop in men who are, say, bodybuilding, putting on a lot of muscle. Maybe they are taking exogenous testosterone, as part of performance enhancement goals, and maybe they are, as a result, having elevations in their estrogens. Well, estrogen can influence the amount of ground substance in the deeper layers of the skin, and also can have an impact on how close together the collagen fibers are. And so these factors may influence and lead to a greater likelihood of stretch mark development development in these situations where you have a sudden stretching force on the skin with weight gain or with putting on a lot of muscle. Also can be seen in people who have a lot of central adiposity, as well as in patients who have end-stage liver disease. They develop ascites, accumulation of fluid in the abdomen, stretching of the skin. They can develop really prominent stretch marks. So those are some of the main skin warning signs. Also, men whose estrogen levels are too high, in addition to loss of facial, pubic, axillary, which means underarm, arm hair, they also may develop testicular atrophy, smaller testicles, and breast development. That's known as gynecomastia. So if you're a male who notices that you're losing your facial hair, your underarm hair, you're developing little prominent dilated blood vessels, and you have the beginnings of breast development and testicular atrophy, those are warning signs that your estrogen is way too high. But your skin is very, very sensitive to changes in levels of estrogen hormones. There are a ton of estrogen receptors throughout our skin on different skin cells, including the keratinocytes, which are the cells that make up the bulk of the epidermis, on the fibroblasts, the cells that produce collagen, as well as on the sebocytes, the cells that make up the oil gland, and of course the hair follicle. And estrogen is hitting those receptors and doing all sorts of things. When estrogen is too high, you can see skin changes, hyperpigmentation, vascular changes. Maybe even an added benefit you might appreciate, especially if you are taking, say, oral contraceptive pills, is that if you're someone who has acne, maybe your skin starts to clear up because it can reduce sebum output. But then, you also may develop hyperpigmentation, melasma as well. A lot of what we know about estrogen's effects on the skin come from studying women as they approach perimenopause and go through menopause and experience a decline in estrogen. Just like what we have covered in today's video with regards to the skin and hair signs that estrogen is too high, well, your skin can also have a lot of things to say about estrogen being too low. And you may be wondering, well, what does that look like? You're going to want to watch the video on the end slate because I cover this exact topic there. So watch that one next, especially if you are a woman, so you might have some understanding of what can go on during menopause and thereafter with your skin in the setting of declining estrogen levels. I really hope this video was informative to you guys out there who maybe are wondering about this. Again, it can impact both men and women. If you all enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.